if you, I don't know if I think they still do it. I tell students this every semester, and some students speak up. If you had a child, maybe you yourself, because my daughter had them and she's 29 now. If you had a lot of ear infections as a kid, they may have poked a hole in this thing and installed a little plastic tube, which eventually falls out because the tympanic membrane refreshes itself, renews itself. But the tube is meant to allow for any pus that is accumulating in the middle ear, which causes tons of pain, to drain out the external ear. And it works in many cases. It begins to reduce the number of ear infections. Okay, I'll tell you about why that may occur in just a second. So the middle ear, as best as we can see it then, is this area right here. Let's put the tympanic membrane back in place. Attached to the middle ear is a tube that runs down to the area known as the nasopharynx. The nasopharynx is part of the oral cavity. It is above the soft palate, so you can't access it. But this opening right here allows for air in the atmosphere to get up into the middle ear, so that air pressure on the external ear tympanic membrane and the middle ear tympanic membrane can be equilibrated. If air pressure and middle ear pressure are different, you feel a little uncomfortable in your ear. And so you hold your nose and you give a little blow. Sometimes you go and try to expand that nasopharynx to open these openings. Sometimes you chew gum when you're on a plane. Keep those openings open so you don't feel this pressure change. The tube is known as auditory tube, eustachian tube,
What number
the
is that?
laryngopharyngeal tube. So you pick one and stick with it.
What is
The
that?
number
That's
on
the one
here
we're looking for, 23.
says 23.
Okay. Thanks.
If you have allergies, if you're young, oftentimes these eustachian tubes get inflamed. And when they inflame, they swell. When they swell, they close. So now you've got bacteria in here, and they can proliferate without drainage. And it causes a ton of pressure, a ton of pain, makes people sick. So the auditory tube is something to drain that out, to basically equilibrate pressure and to provide a drain. There are living things up in here, okay? Bacteria do get in there. I don't know if you know, again, I'm talking a ton. Doctors really don't do a lot of antibiotics for ear infections anymore. They just expect you to live through the pain, get an immunity on your own, okay? You know that antibiotics have been overused, so doctors are, you can go to your doctor with an ear infection and say, well, okay, here's some pain medication, live through it until you beat it. And then you're less likely to have the wrong kind of bacteria in there, okay? The middle ear is connected to the inner ear via the oval window. You have to get in very close on this model. If you look really close in the model, in the middle ear, you're going to see the stapes in there. I'm not even pointing to it, I don't think. It's the general area here. And you're going to find that stapes, and then you're going to lift the inner ear, and you're going to see that the stapes attaches right here at the oval window. The number on the model for the oval window is 32.
And the attachment point is 27.
And the attachment point is 27C. Okay? So now we've gone from external ear to middle ear to inner ear. And we now have gone from sound waves in the atmosphere to the mechanical movement of objects, tympanic membrane, bones, to the production of pressure waves inside the cochlea. Okay? If you're looking for the oval window, the place where these pressure waves are, where the pressure is released, you look right here. The oval window there, the round window there. It's got a number 34 on it on this model. The inner ear is organized into the cochlea, which is the spiral portion, the semicircular canals, which you can see pretty clearly, and then the best I can do is just simply pinch and say this is the area of the vestibule between my fingers. Okay? We know the semicircular canals have something called the ampulla and the crista ampullaris at their base. Okay? We know that the vestibule contains the maculae, the utricle saccule, and we know the cochlea contains a spiral organ. As we take a look around at this thing, we saw oval window, round window. We can see that there is yellow nerves leaving the different ampullae, right? There's little vase-shaped things here. There's a nerve that leaves there. There's a nerve that leaves the vestibular area. That nerve is right here. That's probably the vestibular portion of the vestibulocochlear nerve. We can see the cochlea has this huge nerve that exits, huge nerve passing through here, okay? That's the cochlear portion of the vestibulocochlear nerve. Some distance out here, then the two come together into the vestibulocochlear nerve, okay?
What number is that?
46 is the vestibular portion, 47 is the cochlear portion, and then the model maker says 45 is the vestibulocochlear nerve, the combination of the two. Okay, all right. A couple more, how about a little bit of trivia? This model shows this funny looking purple passageway. Do you ever rest your head and hear your heartbeat? This is I believe this is the carotid canal. If you lay your head a certain way, literally the pulsing of the heart can be heard through the bone and you can hear your heartbeat. It's because of the closeness of the carotid canal to the inner ear apparatus. Okay? A little bit of trivia. Any questions on this model? What?
What are the?
Ask.
I have a couple questions about the numbers. So
Okay.
The semicircular canals.
Alrighty, they have 35, 36, and 37.
So
Cochlea.
that would be each one of these.
Each one of those is, and I'll tell you about those in a second. The cochlea doesn't, well, it's got like a, I don't know, it's kind of rubbed off. It's this thing.
Okay.
Yes, it looks like a seashell. By the way, what's like well, I don't know. There's the word cockle for clams. Anyway, go ahead. What were you saying?
The organ of Corti or spiral organ.
Yes. For that, we have to look inside the cochlea. And so this model maker did make this come off. And that, going from that to that is a little difficult. But that is inside this. Okay?
So that spiral inside is.
Right. It's called the spiral organ. Obviously, it spirals inside there. Okay, so just one more piece of trivia. All right, so there's your ear. So you know this is lateral, this is medial. You look at the semicircular canals. There's one, transverse plane. Okay? There's one, more or less coronal plane. There's one almost in the sagittal plane. Okay? So it's interesting how nature built the orientation of these things. Okay?
It fits together so nice.
Yeah.
It's
Crazy.
It's really cool.
Use your lab manual
Complex.
to help you understand why this is actually a part of this. There are some great diagrams that help you go from this to this. This is, I don't want to scrape that. Well, let's just get this out of the way. This then is a structure that forms a helix, okay? This thing grows and comes out at you and spins, okay? All right? This is in contact with the oval window. It gets the name scala vestibuli. This is the vestibular membrane.
Yep.
Okay? You'll notice it's very thin. It is no barrier to the movement of pressure waves from this scala into this scala.
So this is
That's the vestibular membrane. This is called the cochlear duct. Old books call it the scala media, the middle scala. This is the cochlear duct. This is the scala vestibuli. I should give you the numbers. Scala vestibuli is number 2. Cochlear duct, 19.
Maybe.
Cochlear duct is 19.
Number 19. The scala down here, number 3, is called the scala vestibuli.
Wait,
It's actually Noventa.
Okay. No.
I thought
No.
the top one was
What's it?
vestibular.
All right then.
Noventa.
I was tricking you.
Noventa's 90.
Is it? 90? No, yeah. Ochenta, Noventa,
Right.
Venti.
So it's 10 y 9 is 19.
It's 10 and 9. 19.
Yes.
It's Noventa.
Anyway,
I promise you I'm Panamanian.
we'll continue the Spanish lesson later. Scala timpani. Okay?
That's great.
Yes. If you haven't gotten totally lost, we're talking about the spiral organ.
I do have a question about
Ask.
something you said about the relation of this
Dígame, por favor.
to the oval window.
Okay. All right.
So
How are we going to do that then?
is it just because of the way that we're looking at it?
Okay, let's see if we can do it.
Oh, that's right.
There's the front end of the cochlea where the oval
Uh-huh.
window is located.
Uh-huh.
This scala literally begins at the oval window. Okay? And if, I again, you have to look in your book because they have some great diagrams.
This one?
Yeah. Others too. I'll work with you directly, okay?
Okay.
But we'll get this figured out.
Oh, maybe this one.
Those really help. They help me, but we'll take a look at it.
Okay.
Okay. All right, let's continue with this thing then. Tiara's going to run out of memory. Okay. This is not on your list, but this is a bone which supports the cochlea. Okay? It's not on your list. I just wanted to point out that's bony. This, however, is not bony. This is fibrous connective tissue. This is the basilar membrane. It has a number 6 on it.
The gray part, right?
The gray part. The basilar membrane supports the tissue that gives us a sense of hearing. There are 3 rows of what are called hair cells on the outer edge of the spiral organ, and there's a single row of inner hair cells on the spiral organ. The hair cell has then a bunch of cells around it that are called supporting cells that give structure to this apparatus. The model maker has shown each of the hair cells to have a tuft of microvilli, which we know are called stereocilia, even though they're not true cilia. Sitting above the hair cells and their stereocilia is a gelatinous membrane known as the tectorial membrane. What you heard in lecture were that the tallest of the stereocilia stick in the tectorial membrane. And when pressure waves move through the scala vestibuli and find the vestibular membrane no barrier, these pressure waves cause deformation of the basilar membrane, depending upon the frequency of the noise, which causes the stereocilia to move. This one then would be the roots of what will become the cochlear nerve. This is a ganglia. There is processing of sound information right at the cochlea, but eventually the fibers leaving the ganglia will go off to the primary auditory cortex in the temporal lobe.
Wait, so that's the cochlear over here?
This would be the cochlear nerve out here.
Okay, what number is that?
25, I think.
25?
Yeah. So we have the scala vestibuli, number 2, the vestibular membrane, I think it has a number 4.
Yep.
We have the cochlear duct with the number 19. The tectorial membrane, which it looks like 16, but it may be smudged. We have the inner hair cells with a number 8 on them. We have the outer hair cells with what looks like a G, but is a European 9.